Pregnancy Week 21. At 21 weeks pregnant, you're more than halfway through your pregnancy journey. This exciting stage brings more noticeable changes in both you and your baby. Your baby is rapidly growing, moving around more, and developing essential skills for life outside the womb. Your body adjusts to make room for the baby, and you may feel a mix of energy, excitement, and occasional discomforts. As your bump becomes more prominent, this is a great time to embrace the experience, stay active, and focus on your well-being. You are getting closer to meeting your little one. Week 21 Pregnancy Ultrasound. At 21 weeks pregnant, you may have a mid-pregnancy ultrasound, also known as an anatomy scan. This anatomy scan ultrasound is typically performed to take an in-depth look at the baby's organs, limbs, and overall growth. It provides a detailed look at the developing fetus, including the brain hemispheres and chambers of the heart. The scan checks for abnormalities and ensures proper development. You can also find out the baby's sex during this ultrasound if you wish, or you can choose to keep it a surprise. The ultrasound measures the baby's size and growth, checks organ development, assesses the amniotic fluid level, and examines the placenta and umbilical cord. Throughout the scan, parents can observe their baby in detail, including movements such as kicking and thumb sucking. The ultrasound typically takes about 30 to 45 minutes, and normal findings provide reassurance of healthy development. Further testing or a follow-up ultrasound may be recommended if any concerns arise. Week 21 Size of the baby. At 21 weeks pregnant, the baby is about the size of a carrot, measuring around 10.51 inches long and weighing about 12.70 ounces. Baby size is now measured in full body length rather than crown to rump, so you can get an idea of how big your baby is at 21 weeks pregnant. Week 21 Baby's Development. At 21 weeks, the baby is already developing subtle sleep and wake cycles and may have a favorite sleeping position in the womb. The digestive system matures, allowing the baby to swallow small amounts of amniotic fluid. The liver, spleen, and bone marrow contribute to blood cell formation. The baby's skin is wrinkled and translucent, and they are starting to move and kick, which is called quickening. The baby's sense of hearing is developing, and they can hear sounds inside the mother's body. The baby is covered in fine hair called lanugo, and their reproductive system is also developing. The placenta continues to provide nutrients and remove waste. Your baby's brain is growing, but its surface is still smooth. Week 21 Pregnancy Belly. At 21 weeks pregnant, your belly bump may be quite noticeable as your baby and uterus grow. Your uterus might reach your navel by now and may also be pushing up against your stomach. As the belly grows, the belly button may turn flat or pop out in certain cases. This stage of pregnancy could be considered a golden time, as your belly is big enough to look pregnant and adorable but not big enough to make you super uncomfortable. To show off your new curves, consider wearing form-fitting clothes or cinching a belt just above your bump. If you're 21 weeks pregnant with twins, your belly may be feeling tight, itchy, and dry, and you may have already developed some stretch marks. Remember that each pregnancy is different, so avoid comparing yourself to other pregnant women or trying to compare your experience with previous pregnancies. Just relax and enjoy this special time. Week 21 Pregnancy Body Changes. At 21 weeks of pregnancy, your body undergoes significant changes. Carrying your baby for this long can put a strain on your entire body. You may experience discomfort such as heartburn, hot flashes, and skin changes due to hormonal fluctuations. These changes, including a larger belly button, darker areolas, and breasts preparing for breastfeeding, are normal during this stage. Weight gain will increase, and you may experience cravings for non-edible items, which should be resisted. It's important to remember that weight gain during pregnancy serves a vital purpose, providing essential nourishment for the baby and supporting their growth. Your center of gravity will shift, making you feel unsteady. It's important to be cautious and let your midwife know if you have a fall. Your baby is becoming more active and establishing sleep patterns, which may affect your sleep. Safe exercise options during pregnancy include yoga, swimming, and walking, but it's essential to consult with your healthcare provider before starting any exercise regimen. Week 21 Pregnancy Symptoms. Leg cramps. Sudden, painful contractions in the calf muscles, especially at night, can disrupt sleep. Clumsiness. A tendency to be more uncoordinated or awkward, often due to shifting balance and changing body dynamics. Braxton Hicks contractions. Irregular and often painless contractions as your body practices for labor, sometimes referred to as false labor. Vaginal discharge. Increased vaginal discharge, leukorrhea, is normal due to higher hormone levels and blood flow to the pelvic area. Typically clear or white, this discharge helps prevent infections in the birth canal. Greasier, spotty skin. Changes in skin texture, leading to increased oiliness and potential breakouts due to hormonal shifts. Swollen hands and feet. Puffiness in extremities due to fluid retention can make shoes feel tighter and uncomfortable. Swollen and bleeding gums. Increased blood flow and sensitivity can cause discomfort and bleeding, making oral hygiene more challenging. Headaches. Frequent tension or migraine-like headaches that can occur due to hormonal changes, dehydration, or stress. Round ligament pain. Sharp, brief pains in the lower abdomen or groin areas, caused by stretching ligaments supporting the uterus. Emotional changes. Hormonal fluctuations can impact emotions, leading to excitement, mood swings, or anxiety as you prepare for the next stage of pregnancy. Week 21 Pregnancy Checklist. Schedule your anatomy scan between 18 and 22 weeks. This detailed ultrasound checks your baby's development and can reveal its sex. Attend your scheduled appointments to monitor your health and your baby's well-being. Bring a list of questions or concerns to discuss with your healthcare provider. At 21 weeks, you might feel regular baby movements like kicks and flutters. Track these and inform your doctor of any significant changes. Explore your birth setting options: hospital, birthing center, home, and pain management methods, natural, epidural. Discuss your birth plan with your healthcare provider to communicate your preferences. Sign up for prenatal classes for childbirth preparation, breastfeeding, and newborn care. These will help you and your partner prepare for labor and life with your baby. Start researching baby essentials like a crib, stroller, car seat, diapers, and clothing. If you're planning a baby shower or creating a registry, now's a great time to start. Start researching pediatricians in your area and choosing one before your baby arrives. Ask friends or your healthcare provider for recommendations, and schedule interviews if necessary. Understand your company's maternity leave policy and discuss your plans with your employer for a smooth transition. Be aware of warning signs of preterm labor, like regular contractions, lower back pain, or fluid leakage. Contact your healthcare provider if you notice any of these. Week 21 Pregnancy Tips. Your belly is likely growing, so consider investing in comfortable, maternity-friendly clothing that accommodates your changing body. Eat smaller, frequent meals rather than 3 large ones to manage increased hunger and prevent heartburn. Include nutritious snacks like fruits, nuts, and yogurt to keep your energy up. To relieve back pain, maintain good posture, avoid heavy lifting, and consider a maternity support belt. Moisturize areas that stretch, like your belly, breasts, hips, and thighs, to reduce itching and minimize stretch marks. Wearing compression stockings can help reduce swelling and discomfort in your legs or feet, especially during long periods of standing or sitting. Use a footrest when sitting to elevate your feet slightly. To manage stress and mood swings, practice relaxation techniques such as deep breathing, meditation, gentle yoga, and prenatal massage. These methods can also help prepare you for labor and delivery. For more videos like this, please like, share, and subscribe.